Welcome back to AM Northwest. Health problems elsewhere in your body can actually take a toll on your teeth. And here to tell us more, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee, along with his patient, Arielle. Good to have you both with us. Good to see you again, Doctor.
Thanks so much.
Arielle, let me start with you, though. Tell our audience, what it is that you have? You have two autoimmune disorders.
I do. I have Ankylosing spondylitis, which presents itself kind of like rheumatoid arthritis, and Crohn's disease.
And how does that affect you?
It affects my joints. It can be very painful, a lot of stiffness, hard to move, and then the Crohn's is stomach problems.
And then you have to take medication for both those issues, obviously.
I do, and luckily the medications I take actually cover both diseases.
Okay. Doctor, how do those diseases affect her teeth?
Well, you know, I have a lot of patients that come in with autoimmune disorders, and basically I've seen that a lot of the autoimmune disorders that I see, the rheumatoid arthritis, the ankylosing spondylitis, the Crohn's, they actually, I think they actually rob the enamel of a lot of its strength. And so the enamel is the strongest substance in the body. It's harder than bone.
Right.
And so when it gets demineralized, it gets softer, it's more prone to cavities. And a lot of the medications that these patients are taking, the steroids, the Humira, the Enbrel, the Remicade, they can cause a lot of dry mouth as well. And so basically you've got soft enamel, you've got dry mouth, and basically...
Does the dry mouth affect the teeth as well?
Dry mouth basically makes it so there's no saliva, and saliva helps wash away the bacteria that cause cavities. So all of a sudden you've got this condition where all these cavities are starting because a lot of these patients also, they're dealing with all these other medical issues and they don't go to the dentist.
Right.
Yeah.
Why did you decide to finally go to see Dr. Lampee?
I was having some dental issues.
Right.
But when I first got diagnosed is when I first started having dental problems, and I did have a dentist, but he and I didn't have a very good relationship,
Sure.
I'd say. I developed a lot of fear.
Right.
And my mother actually found him on the internet and then had our family dentist look him up to make sure he was good.
Right.
And that's how we found him.
So what did you see when you're looking at Arielle's mouth? What did you see, and how did you help her out?
The funny thing is I didn't even get a look in Arielle's mouth the first time I met her.
Right.
I remember when her and her mom came into the office, they were really scared even to walk in the front door. And so they went out and sat in the waiting room eventually, and then my staff came and got me, and they're like, they want to come and talk to you out in the waiting room. They want you to come out there. And so I met Arielle and her mom for the first time just sitting in the waiting room there talking for about 20 or 30 minutes just about kind of what's going on with them and what am I about, and you know, how can we basically get this done, because she was so scared.
Anxiety.
Right. Yeah.
Well, you know, that's a really good point to bring up, is that if you can meet your dentist before immediately going in there and being intimidated by everything, then you build up a relationship first. That makes a lot of sense.
There's so much to it that is trust, because just a couple of negative experiences can have a lifetime of effect on a patient. And I mean, Arielle and I now, we get along really well, and
we do.
We have to do a lot of work to keep her teeth up, to to fight the decay with all these autoimmune disorders. And now, you know, a lot of the anxiety is gone. We still do, you know, our sedation, sleep dentistry, stuff like that. But so much of it is trust and knowing that we can handle this. And there was a time when, you know, she had other dentists tell her, well, you're just out of luck. You're done, basically, for your teeth. And we've come up with a game plan. We're going to save these, basically.
Yeah. So I have lots of crowns.
Oh, okay. But now you're feeling better, and your teeth feel better, your mouth feels better.
Yeah.
And then, so what did you end up doing? I mean,
what we've done.
You said you came up with a plan for her.
And you know, the thing is, with a lot of these autoimmune disorders, if we're going to keep the teeth, it's an ongoing plan.
Sure.
It's going to be probably every year or two, we're going to have more work to do because the cavities are going to start. So we've had to do root canals, crowns, and that's just the way it is if we're going to keep him.
And he's had to redo a lot of old dental work that I had done.
Yeah.
Okay, we want to tell folks if they'd like to find out more about Dr. Heath Lampee, you can at Sleep Dentistry Defined. You can meet with him before you go make an appointment. That makes a lot of sense. Call 503-646-2273 for more information. And, of course, we'll put all that information on our website at KA2.com. Thank you both
very
so
much.
Appreciate it.